Dean, welcome everybody to our discussion with the American Institute for Economic Research. We have hundreds of people signed up, 800 registrants, so thank you for being here and joining us for our discussion on COVID-19. Must we choose between the economy and health? Before we begin, let me share that we are here. We can answer some questions. And to do that, you can use the Q&A chat box at the bottom of the screen, and we will try and answer them. There's going to be too many people for us to answer all questions, but I will look forward to interacting with you. So let's begin. I think that everybody here agrees that we want to be protecting people, and particularly we want to be protecting vulnerable people from this disease, which harms people in sometimes a very vicious way and is highly contagious. The question then after that is, how do we best do that? And do we need to have a complete lockdown on the economy? And if we do have a complete lockdown on the economy, what are the potential downsides of that in terms of disruption of supply chain management, of food production, of distribution of food to lower income Americans, or distribution of food to people in some of the more poor countries? So I think a lot of people in the world recognize that that could be a big threat. And so the question is, are there these choices that we need to make? My name is Edward Stringham. I am president of the American Institute for Economic Research. We are an 87-year-old not-for-profit institute founded to study the importance of markets and also study the potential pitfalls of interference with it. Right now, we've got an unprecedented number of people on unemployment, and what are the potential effects of that? What are the costs of that to future taxpayers, to future people who don't have their businesses functioning? AIER was founded in 1933 as a rational response to the Great Depression. And so leading our way through national crisis is in our DNA. I am very pleased to introduce some very esteemed guests here. We've got Knut Wittkowski, who is the CEO of Hysteria, and before that he was working for 20 years in the Department of Biostatistics, Epidemiology, and Research Design at Rockefeller University in New York. He also worked for 15 years with Klaus Dietz, a leading epidemiologist who coined the term reproduction number in the epidemiology of HIV. Our next guest is Robert Luddy, founder and CEO of Captive Air Systems, which I am sure everybody here has used it. If you've gone to a restaurant, chances are you have seen his HVAC units in the kitchen. So we can all thank him for that. A prominent entrepreneur, educator, philanthropist, business leader, hailing from North Carolina. And he's recently been writing about the COVID-19 crisis, including in American Spectator, which has been the site's most popular articles. And then next we've got another friend of mine, David Henderson, is author of American Institute for Economic Research, viral article, Liberation from Lockdown Now. David and I became friends when I lived in California 18 years ago. He's a research fellow with Hoover Institution at Stanford University and emeritus professor at Naval Postgraduate School. He's also editor of the Concise Encyclopedia of Economics and published in all the top news outlets, Wall Street Journal very frequently. So we're very, very honored to have such esteemed guests. And I'd like to just jump into some questions. We've got people who are saying, this is a Business Insider a month ago, they said the coronavirus pandemic presents an unprecedented challenge to the world's nations. Choose between the economy and health. The rest is history. We have a lot of various policies in different states. In some states, you can still go to work. In other states, work is absolutely prohibited unless you're classified as an essential business. So for example, in Michigan, you cannot, if you're a lawn mowing company with no interaction whatsoever with your customers, you cannot mow lawns by law. And a lot of people are starting to feel the pain of this. The flip side of this is when certain people say, well, should we be able to go to work? Many have been described as, quote, virus spreading sociopaths. And the governors, people refer to any opening of business as reckless. So today we're asking the question, is it an either or choice between a healthy economy and a healthy populace? Is that even true? So let's start with Knut, please.
Thank you very much. Because I'm currently being attacked, I would like to make two very short statements. I have never been a professor at the Rockefeller University. I had an academic career before that. And Hysteria is developing IP for a drug that might prevent infection with coronaviruses. But aside from that, I don't think we have to make a choice between the two. I think we can do both. We can keep the economy going and we can make sure we're doing a rational strategy in dealing with that virus infection.
Okay, great. And we'll get to some specifics in a few minutes, but David.
Yeah, I think economists always talk, and I definitely talk a lot about thinking on the margin. So thinking on the margin and thinking of economics in a very narrow sense, I think there is a trade-off, and we were making it without the lockdowns. So think about when they canceled the NBA or put it on hiatus for 30 days. That was a completely voluntary decision on the part of a large business because of their fear. Of course, that hurt the economy of the NBA. It was a pro-health move. Whether or not it was justified, Knut might have something to say about that. I'm not an epidemiologist. So on that margin, yes, there might have been a trade-off. But there are all these things. You mentioned one of them, Ed. Running a lawnmower business, guess what? You're outside. And from everything we know, it's better to be outside without people around you than to be inside with people around you. And so there's no trade-off. You want more freedom and more health. So there are a lot of margins on which that's true. So it's a more, in other words, it's a more nuanced issue than just an all or nothing. But I agree with Knut that we can have a much healthier economy than we have now, because all kinds of things have been closed down. Whereas, I mean, and here's my point, I've been making it in various articles and blog posts. A huge percent of us, especially the elderly like me, we're doing a lot of social distancing a week or two before my governor in California did the lockdown. In other words, we were doing the things people say we should be doing. And so what happened is the California governor never gave it a chance.
Okay, great. And Bob, you view
Yeah,
this trade-off.
it's not really a trade-off, because to have good health, we need a strong economy. So think about the hospitals that are not taking heart patients and cancer patients, waiting for COVID patients who have not arrived. So in North Carolina, the hospitals are losing $1 billion a month waiting for COVID patients. Think about 26 million new people on the unemployment rolls. Some of these people may never get their jobs back. The devastation to their family, their health, and their financial well-being is overwhelming. So we've made a very bad choice. And the last comment is, if half the people are considered valuable and they can work right now, why couldn't 75% of the people be working? So they've made a very arbitrary choice. And certainly the government has no idea what the vital industries are and are not. They're all vital to our economy. That's why they exist.
Great. Knut, could you share your thoughts on some ways, if we want to be very careful to protect the vulnerable, to protect them without shutting down pretty much all of the economy? How could we, what would you think on that?
I fully agree. I fully agree what the elderly have done all the time for many years. If you hear a flu is running around, you isolate yourself because you don't want to expose yourself. There was also a very early experience in Seattle that a lot of inhabitants of a nursing home, and that was out of a warning sign as it could be, that we should shut down the nursing homes, pay the nurses or other personnel overtime so that they can lock in with the elderly, so nobody gets into the hospital, into the nursing home carrying a virus. This would have been an extremely effective way to prevent deaths among the elderly, and it's totally unclear why the early warning signs from Seattle were totally ignored.
And that's a very interesting proposal. And just if we want to think about the costs of that, I mean, what if you want to just think of an idea, how much would it cost to pay all these nurses to stay in the nursing home versus shutting down the economy?
And
Okay,
by the
if
way,
you had paid everybody,
sorry, on that.
This is for Knut, please. I'll get to you in 1 second.
Okay,
David.
sure.
You could have made any of those a millionaire and it would not have been $1 billion.
Okay, all right, David.
Yeah, there was a case I read online just about 3 days ago.
$1 billion. Sorry.
About the Sheffield, I think it was in Sheffield, England, where they did that. They had all the nurses stay with the people, and it worked out very well. And so they actually tried that, and it worked.
Okay, I'd like to ask you each year. Everybody here is on record with various opinions, and sometimes at odds with what you might see in some of the, I don't know, more worrying parts of the media, or the media that's whipping people up into a frenzy. Since your original statements, has anything happened to make you question your views, or have they simply been reinforced? Bob?
I'd say they've been reinforced based on new data that we have. For example, the information that came out of New York today, how many individuals have already had COVID.
Yeah, and for the viewers, I would like to share that study. They can study your blood, do a serology test, and if you've already had it, you have antibodies showing that you fought off the virus. And it turns out in New York City, 21% of New Yorkers already have had and recovered from COVID-19. Can you just explain a little bit how that works? Because there's this idea we're all going to die versus wait, we've 21% of people.
That confirms what epidemiologists have said forever, and has been seen in Sweden and California and everywhere where people have done these studies. Most contact with the virus results in immunity without people even noticing that they had an infection, or with a very mild infection. Like we were discussing before, there was, yeah, you may have a cold, feel that you're a bit off for a day or two, and then that is what it was. And what we now see is, with already 20% being immune, it means we are a long way already in the way to herd immunity. The curve is going steeper, and it will be only a week or two, and we have more than 50% of people immune.
So Ed,
And then eventually the number of new infections will go down, and the epidemic will be over, like every other respiratory disease epidemic before. It's just the same thing all the time.
And when, just in terms of your predictions of when you think that will be over, some people are saying, it's going to be forever. We're going to have to be in lockdown forever. What is your just prediction based on you looking at the data where we are?
The CDC has actually published data from the AIER, the influenza-like infection or disease network. And that showed already 2 weeks ago, or more than 2 weeks ago, that the number of new infections had peaked and was going down before any social distancing was implemented in the United States.
Fascinating. So I can say that the data that I just looked at for New York are very, looking good trends, fewer people going to the hospital, fewer people in the hospital. And that's really been a huge improvement. The deaths trending down in New York. And David, you wanted to say something?
yeah, you asked about have my views changed. My views have actually changed radically. About a month ago, was really concerned about various friends not taking this seriously. And so a friend of mine, Charlie Hooper, who I've published with in the Wall Street Journal and elsewhere, was saying he thought it was just kind of a bad flu season. And I was saying, no, Charlie, I think there are going to be at least 200,000 deaths. And 200,000 was a number that I was a little conservative on in my mind. I thought 300,000, but I'm a betting man, and I was ready to bet on 200,000. We made a bet about 100,000, and I blogged about it. And what my motivation for making bets is not to win money, mainly, because it's like, I don't know, $100 or something. My motivation is then it focuses me on checking the facts. And I said to Charlie, why are you so confident? And he said, look at the Diamond Princess. Look at everyone was tested. Look how many people had it, 20%. And look at how many people died. 8 people died. So 1% of the people who had it died. And it was that, and remember, a lot of the people on those cruises are old people. And so it was that kind of thinking that dramatically changed my view. I'm, by the way, not positive. I'm not Knut. I don't know what he knows. So I'm not as confident as he is. So my view has come on the number of deaths has come down slowly. But anyway, that's how I've changed.
Can you explain to us what is community immunity or herd immunity? And can you explain in general how other viruses that have parallels to this just eventually go away?
Okay, with every respiratory disease, the virus spreads, people become immune after a week or a few more days. And at the very moment where more than 50% are immune, the number of new infection drops because it becomes more and more difficult for somebody who is infected to find somebody to infect. And that is the normal course of a respiratory disease epidemic. And it doesn't really depend on what the virus is, whether it's a corona or an influenza virus, it's the mode of transmission, the respiratory disease where you in New York, in the subway, you are meeting a couple of hundred people a day. You can no contract tracing. There are lots of, it's just spreading a bit like a wildfire, but that's not bad. It's like wildfires are good in general for nature, and so our viruses are good for humans. We are designed for that. There is no real problem with it. We can handle it, and it happens every year. And that's why the first 3 months of the year are called the flu season. That's why we have flus, and we have never shut down the country for a flu, and we shouldn't.
Right, and this one is, it's dangerous. It's a, you know, there might be some parallels to some of the other viruses. It's dangerous in a different way. It targets, particularly targets vulnerable people in a different way. So it's something we wanted to worry about. The question is how. Bob, could you just get into some of the details about some of the people who work for you and some of the people you do business with? Maybe if you could just tell us what has happened to your business specifically, and then some of the other people supplying to you, and on down the chain.
2 or 3 examples. One, before our schools closed down, we didn't have a single case of COVID in any teachers or students.
Wow.
A mother of one of the child did have COVID, but he never got it and he never passed it to anybody. So there's a pretty 5,000 kids. At Captive Air, we have almost 1,500 employees. About a week ago, we had 1 case of COVID, a couple of weeks back. It's not been passed to anybody else. So in the entire country, 7 operating plants, we had 1 case and it was not passed along. If you look at, we have a plant that serves us out of Milan, Italy. And even at the peak when everything was shut down, they were authorized to run. They never shut down a single day. They continued to ship product to us. And I would tell you, from working class people, they want to work because they know the economic relationship between working and eating.
Yeah.
People who work for the government, who get paid to stay home, they're just happy as they can be. They don't have to work and they get paid. But those are the people that are making the orders that tell us to stay home. We're not allowed to work. So it's a grave injustice. And if you talk to common men, people with common sense, they don't know what Dr. Knut knows, but they have a sense that they've been greatly harmed.
Amazing. David, you have probably heard this, the term some of the governors will say is oh, if you advocate any businesses opening up, you're a virus spreading sociopath. How would you respond to that?
Well, first of all, I just want to say I think Robert put it so beautifully. I would respond, you're not. But more specifically, and let me quote Eric Garcetti the other day, the mayor of one of the premier cities of the country, Los Angeles, who said that people who want to open the floodgates, he said, if you open the floodgates, and these are the protesters, you're going to kill all your friends and all your neighbors. I mean, he literally said that. It's stunning to me because even when I was worrying about 300,000 people dying, which is 1 in 1,000. So anyway, I think when you see someone doing a lot of BS, you know there's not a lot there. So, I mean, I would respond by just kind of laughing at him and you know, just let's talk to some serious people. And he's not one of them.
I saw a picture the other day of a couple getting married and kissing each other on their face masks. And so I'm glad that they are going to be preventing the spread of disease inside their new home together. Knut, can you address the idea that certain people were worried about that we did not have the hospital capacity if the virus went up so quickly the hospitals wouldn't be able to handle everybody at once. And so the idea is everybody, the same amount of people are going to get it, but we're just going to spread that a little bit slower over time so our hospitals don't get overrun. Now, it's very clear at this point that the New York City hospitals did not get overrun. The HMS Comfort is now being sent away from New York. So we're in a good situation now, but is it something that you potentially could worry about that happening? And
no,
why don't you worry
because
about it specifically?
The epidemic should run among children and young adults, and they don't need hospitals. And the elderly people and the vulnerable should be isolated in their nursing homes or at home. We should have home delivery of prescription drugs, of food, of laundry, to make sure that those who want to isolate themselves can do so. And that would keep the hospital utilization low, and we would get herd immunity very soon, faster than with the current strategy, and the threat for the elderly would be over earlier with fewer of the elderly people becoming affected.
I see. So because it's so dangerous for old people, but it's not very dangerous, if at all, for kids. If the kids get it so quickly and they become immune, then they're at less risk to pass it on to their grandmother compared to now.
Originally, people were thinking that children would have natural immunity against the virus because you would never see any symptoms. And then they tested their blood and found, oh no, they have antibodies. So they're actually getting infected, except nobody notices it.
Amazing. Bob, can you also just jump in here and fill in some details about, some of these people you talk with all the time, these people who want to get back to work. And then also, could you just comment on the state of your factory? You tell me that I think you shut your factory in North Carolina is just shuttered at this moment. And I mean, why is that?
Well, we have 6 U.S. factories and 2 in North Carolina. We shuttered that factory just because we couldn't make deliveries. We have orders, but we can't ship when everything's closed down. If you look at nationally, companies operate in real time. So the stock market makes corrections minute by minute every day. And it seems like people in government don't understand that. So we've never seen such devastation. If you look at our customers, hotels, restaurants, travel, and all the ancillary support mechanisms, they're all shut down. Some of them have lost 80% of their business. Airlines have lost 90% of this business. If we were talking about this hypothetically, we would all be laughing because they would say that could never possibly happen. And yet it happened in 5 weeks. The government closed down our economy for the first time in the history of the world. They denied religious freedom, which is the core of all freedoms. So this is a serious long-term problem, not the COVID, as Knut has informed us about, but the fact that the government has complete power over our lives. And think about futuristic. Would you want to make investments in states that can completely shut down your business for as long as they want, arbitrarily, and basically bankrupt you?
Amazing. Knut, I've been kind of surprised by some of the statistical inferences that people in the media make, or just interpretations of basic scientific statements. So Fauci will say, right now we don't have evidence that, I don't know how to pronounce this thing, chloroquine is effective, but it could be effective if we studied it. And then the media immediately, including my favorite newspaper, the Wall Street Journal, immediately says, Fauci said it is proven ineffective. That's just not, that's not what he said. So can you maybe comment on your reaction to some of the scientific analysis that you hear coming out of various politicians' mouths and or some of the politicians' mouths. Do you believe they have consulted scientific community and the medical community appropriately?
No, they have not. They have consulted a few individuals, but not the scientific community. In Germany, for instance, there is a whole academy of science that advises the government on science. And they have urged the German government, they haven't done it, but they have urged the German government to open schools as soon as possible, because there is no scientific evidence that closing schools had any benefit. And working forward, it's probably the first thing that should be done now, as they recommended. Make the schools open again and let the virus produce infections, symptomless infections among children, and thereby create herd immunity to protect the whole population.
Amazing. I'm going to come up with some additional questions, but I'm going to get to some questions from the audience here. We've got Judy Watson asks, can you comment on the views of one specialist whose, I'm going to just read it word for word, model isn't even usable by other people, is privileged over those of many others. Specifically, how did Neil Ferguson's model get so amplified?
Are you asking me, or are you asking somebody else?
Yes, you.
Sorry, I didn't quite hear you.
Well, I know zero about it, so let's go with Knut here.
It was an absurdity, and unfortunately, it was not the only absurdity that Neil Ferguson has ever published. But the problem with what he published at that time, or not really published, was that the assumptions he made in his model and what exactly his model did was never made open to the scientific community to discuss. So if you keep something locked in a box and don't tell people what it actually is, and you come up with some astronomical numbers, that is not science. Yeah,
he was, his model was saying upwards of 2 million people could die. Now he did put in a lot of if-then statements, so it is possible that it could be very dangerous, more dangerous than actually turns out to be right now. It is possible that it could be very easy to spread, and it is possible that the hospitals get overrun. Now, those things didn't actually happen, so theoretically his statements are not incorrect because they were if-then statements, but so many people took it as gospel that 2 million people are going to die.
No, it's even now, just a couple of days, I heard the argument, well, if we hadn't done the lockdown, we would have had 2.2 million deaths in the United States, which was his number, but there's no evidence that this risk ever existed. So these are all numbers that are pulled out of thin air and have no relevance to the discussion that we need to have.
So at this point, we're seeing a decrease in the number of deaths, decrease in number of new cases, and hospitalizations, at least here in New York. And so it seems like maybe the virus is on its way of playing itself out. What do you think of the idea that the lockdown created these decreases?
The lockdown was too late. As the CDC has shown in the data it presented just about 10 days ago at the task force meeting, the number of new infections was already declining more than a week before the lockdown started. And that means the lockdown had no effect whatsoever.
Wow, that is quite something. David, can you comment on how things are in California in terms of do you have a lot of would you say the average government official in a local town or the governor is very well trained in science and analyzing the economic consequences of their proposed policies?
No, I wouldn't. And I want to start with my area, Monterey County, and then work my way up to the governor. The public health officer in Monterey County, we have, to put in perspective, we have 434,000 residents. The public health officer is a guy named Dr. Edward Marino. I don't know what his training is. He is a doctor. He was going by a model, and he admitted this last week. And he was the one who persuaded the Board of Supervisors to shut down the county. He was going by a model that told him that as of last week, there should have been 9,000 cases and 300 hospitalizations. In fact, we had 109 cases and 22 hospitalizations. So our hospital is one of the ones that's doing badly, by the way. And it's a great hospital. I've spent parts of my life there. He presented this to, he didn't focus on that when he presented to the Board of Supervisors last week. He focused on this, the following statistic. He said that 6 weeks from last week, so 5 weeks from now, there will be 33,000 cases in Monterey County out of 434,000. So his model was off by an order of magnitude, and he didn't adjust it at all. He presents this to the Board of Supervisors. There are 5 of them. I know actually one of them. They don't ask him a single question about that. So these are ignoramuses. These are people making decisions for 434,000 people who don't ask basic questions. I put this on my blog and someone said, oh, they need training. They need all this training. They need to know the difference between 9,000 and 300. How much training does that take? So that's that level. That's the one I, of course, followed most. Now the governor. The governor, Newsom, was the first one to impose a lockdown. He did that on March 17th. He never told us what his model was. He never said, but he did tell us one statistic. He said he expected 56% of people in California to get the virus without a lockdown. And so, of course, he went to the high end of these percentages. I noticed Knut nodding his head, so that's probably a realistic thing.
Now,
but how bad is it, right? And
let me say something to that. It's good.
Yes.
Because these people, getting the virus makes you immune. It
Yeah,
doesn't
right.
make you ill.
Yeah, right. And so he said that, he got people all scared. My daughter's business has been wiped out. She's managed to really adjust. She teaches Pilates, so she's doing that online and doing an amazing job of it. But anyway, it was temporarily wiped out. And so she wanted to watch his press conference last week, along with her roommates, one of whom is an MD, because they want to be let out, right? They want to be let out. And she was very disappointed because he laid out 6 steps that have to happen before he even, not before he ends the lockdown, before he thinks about ending the lockdown. And he's formed something that I call the cow cartel, California, Oregon, and Washington, cow, okay? And they're going to make the decision in lockstep. And I don't know who they have advising them. I don't know what their expertise. I'm doubtful it's very good. Or either that, or he's a very, very poor spokesman.
Amazing. Bob, recently, this is another question. It says, there's an article this week about Connecticut police using drones to monitor social distancing. And I'm just wondering, what are the this is the question, and I'll have a follow-up question for myself. It says, what are the implications of this for businesses? And then just thinking about how intrusive that could be if you have these rules within all factories. I mean, what risks do you think you would see for some of these policies?
Well, first of all, they're creating police states. I mean, there's no difference between martial law and a police state based on what some of these governors have done. Secondly, they've implanted this fear into people so that every person is a suspect. Even in your own family, they're suspect if you didn't do all the right things that the media told you to do. If you go into a grocery store, people won't even look at you because you're a suspect. And if they talk to you, maybe something comes out of you and they get the COVID. So social behavior in the future is going to be challenging. Individuals remain as suspects long-term. This is going to be very bad for businesses. It's going to be bad for schools and bad for our society. And when this is over, we have to take that power away from governors because we can never let this happen in our country again.
I think it's actually a bad experience for health because initially the power given to the governors was given to the governors to prevent the people from smallpox or other deadly diseases that could really decimate the population. And it's now being abused for a flu. And in the end, people will ask exactly these questions. And then if there is a really dangerous disease coming, suddenly we may not have the tools anymore.
Ed,
Can I just jump in and just ask you, I know previously you had said in one of your other interviews that you said it's like the flu, and I'm wondering if I mean, one can say, okay, there's parallels with how diseases spread and dissipate, but each one itself can be different, and this one particularly the way it harms vulnerable people, specifically their lungs, not necessarily even going through the pneumonia-related illness. So would you, when you say it's like the flu, are you saying there's parallels to the flu in that sense?
Yes, the dynamics of the disease in general are the same.
Got it.
First
Okay.
thing, they don't spread in the open air. The other thing is they come, peak, and go because they're transmitted by air, by breathing from one person to the other. The basic reproduction number around 2, and that is, sorry, my phone is interfering. That's not dramatical, and it's very similar in all of these diseases. Now, they can have subtle differences. Some hit children more, some hit the adult more, some hit those with one comorbidity or another comorbidity. There are certain differences, but if you look at the impact of the disease, the curves, how it spreads, it is, all of these respiratory diseases are very similar.
Fascinating. Go ahead, David. Yes.
can I ask Knut a question? And this is actually prompted by my own interest and something I'm seeing some of the questioners ask. How confident are you that if they open up in Georgia, which I guess they're about to do, I'd just like to know what you think will be the effects roughly.
We now have data, as we expected, on herd immunity. We're getting there. We may not be quite there, but we're getting there, which is very good to know, because it means if we are reopening, it won't be as bad as it was in the beginning, because if already 20 or then maybe 30 or even 50% of people are immune, even if there should be a rebound, it will be minor.
Thank you.
It will not be what people were initially concerned about. And so I think it would make a lot of sense to initially open schools immediately, or as soon as possible, as the Leopoldina in Germany has recommended. And then very soon thereafter, or at the same time, begin opening businesses.
And would you include bars in that list as well? I assume that's a yes.
I don't. It was exactly 100 years ago that we had prohibition. and now we have prohibition again. The first prohibition, well, I don't think this prohibition will be much better.
So suppose we could actually, test everybody on a regular basis and say, okay, right now we know for a fact that 21% of people in New York City have immunity. Those people, Bob, do you see any economic argument for keeping those people locked up? And I'm going to transition that into another question from one of our guests, Thomas Schinkel, says, do you think the small business community has a right to sue the federal government for damages?
They certainly should, but they would be bankrupt by the time they went through a suit, and they'd never get any money. Supposing they said that 20% have had COVID and they can go back to work. How do you operate a business that requires multiple talents with 20% of the people? And these arguments are so lame. I can't even believe an intelligent, educated person brings it up. And I would further say it's an indictment of our colleges and universities that they're turning people out that cannot think, cannot calculate, and are very unreasonable.
Yeah, people are innumerate.
Yeah, I think that's fair. And of course, if they sue the government, you know who pays, right? We pay. So I hope I don't know. I'd love to have them sue the government, have the government lose, and then, some of them have to run naked through the streets or something, but don't take our tax money.
Okay,
frankly, I'm not in favor of that. I don't think I want to see them naked.
Okay, this question is for Dr. Henderson from John Alcorn. Would you please assess the macroeconomic consequences of the federal government's monetary and fiscal policies around the pandemic?
Well, I'm going to answer the easier one first, which is fiscal. I just submitted my biweekly column to Hoover 2 hours ago on this, so I'm really up on that. And the monetary, I'm going to say a little less about because I'm a little less sure. This is called a stimulus bill, the 2.2 trillion bill. I don't know if my editor will use my title, but I titled it the anti-stimulus bill. The point is, what it's trying to do with all this paycheck protection is keep in business various businesses that might actually, maybe we shouldn't keep in business because there will be different demands and different needs in the future. And so it's kind of an industrial policy. It's kind of keeping in place a certain structure of business. One of the worst things is the $600 per week addition to unemployment insurance for people who get unemployment insurance. You're going to have, as a rough estimate, 20 million people at least getting paid more to be unemployed than to be employed, because 600 on top of an average of 350 is 950 a week, and they don't pay payroll taxes on it. And so they're going to be literally tens of millions of people getting paid more to be unemployed than employed, and that ends at the end of July. Hopefully Congress won't renew that. But what I point out is that's fiscally just horrible, and we won't even start to have a recovery. Let's say we opened up today. Let's say Gavin Newsom said, David, I saw the AIER thing. We're going to open up California. Well, you might open it up, but you're not going to get a lot of employment in restaurants and bars because people are better off taking unemployment insurance. So we won't get a recovery till sometime in August at the earliest. So that's kind of fiscal on the fiscal side. Of course, the other thing on the fiscal side, a huge increase in the deficit. Who thought even 2 months ago we would be talking seriously, not about $1 trillion deficit, which seemed absurd, but a $3 to $4 trillion deficit. So just in that sense, it's horrible. On the monetary policy side, I don't know monetary policy as well. Do I trust the Federal Reserve? Absolutely not. Do I think they might have learned some things so they can maybe adjust? Maybe. I'm a little nervous about that. I was about to make a big payment on my fixed interest mortgage at 3.39%. I'm no longer going to do that because my mortgage is the only inflation hedge I have. So I am more nervous about inflation than I've been since the early 1980s. I want to just add, and my colleague at Hoover, John Cochran, has written a lot about this on his blog, The Grumpy Economist, that the Federal Reserve is now in the business. Forget about whether it causes inflation. That's an important issue. But Jeff Hummel and I have been writing about this for a few years. The Federal Reserve is even more in the direction we said they were going. They're in the business of allocating capital. They are essentially allocating capital for the whole US market and even to some extent for the world. That's very scary. So even if they don't go maybe above 3% inflation, they might mess up in a lot of ways. So that's my biggest concern about monetary policy, not inflation, but about the incredible power 12 unelected people have over us.
Yeah, so for those of you who haven't studied this, the Federal Reserve is now, instead of just making loans to banks, which is what it historically used to do, now it's actually making loans to individual businesses, specifically with their involvement in the corporate debt market. And a lot of people are worried about that, saying now the market is not analyzing interest rates in individual debt issues properly because it's being determined by the government. The interest rate is usually a good indicator of how risky a particular company is. And now that interest rate is not reflecting that. So that could be a real problem. Bob, can I ask you, there was a question earlier. There's a lot, I know you're very worried about what's going on right now, but suppose we could just eliminate all of these crazy policies very soon. Would you expect what they call, the V-shaped recovery, the quick recovery, or do you think it's going to cause a lot of malaise for a long time?
I would say the latter, a malaise for a long period of time. Basic law of the jungle, it's very easy to tear something down, to bomb it, and to blow it up. It's very hard to build it. It takes very skilled and dedicated people a long period of time to build things. And the government has torn it down. They become the capital allocators when American entrepreneurs are the best capital allocators in the history of the world. The government has taken that role away from them. And as Dr. Henderson pointed out, some of these businesses don't need to exist in the future because people are going to make different choices in life. We don't know what they are yet. So there's not going to be any V, there's not going to be any U. It's going to be a long, hard slug to get out of where we're at.
Knut, this is from a viewer from England. He says, I work for a cabinet minister in the UK government. The government's taking the line that lockdown extensions are required to prevent a second wave. In response to the restlessness from business owners and the common man, they say that a second wave of the virus would be more damaging to the economy than further lockdown. Is there sound logic on this? And let me follow up with another question related to something I heard you say the other week, where this lockdown actually has the potential of delaying the community immunity or the herd immunity from happening sooner. So how would you respond to that?
Okay, we have seen now in New York, before that in California, in Sweden, and other places, herd immunity is building. And so the next wave will benefit from the herd immunity that is already building. And so the next wave will be much less than the current wave was, that was already lower than people had feared. So I think we won't have a problem to just reopen, let it run. If there is another wave, it will just be another flu, and it will be a relatively mild flu. And we have had many of these flus, and the world has gone on. We don't need the draconian measures to fight a flu.
Okay, and you would, again, agree that it's different from the flu, but it has elements of it, like it. Okay, David, this is a question from John Osterhout. why does this virus seem to be producing unprecedented levels of hysteria compared to past pandemics like H1N1? I'm going to just give an example. I was looking outside my window yesterday, and down at the park, there was a father and his daughters, and they were in the park, and they were practicing social distancing, and the park was completely empty. But what the guy had done was he had put a circle of cones in a 6-foot circle and told his daughters that they couldn't leave this 6-foot circle in a completely empty park. So I guess we'll have Knut, maybe could you talk about whether that's a scientifically sound way of protecting your children? And then I'll get to David in 1 second.
No, the scientific sound thing is to make sure the children get infected. And it's not a totally new concept. We had that until a couple of decades ago, until there were vaccines around. People would have a chickenpox or measles parties to make sure all children get infected and be over it. And the same is true today. If we don't have vaccines, let the children infect each other. This is not the end of the world if a child gets the flu.
Okay, and then at the same time, protect the vulnerable. So David, tell me how you would react to the, do you think there is unprecedented levels of hysteria? And why?
Oh, I think so. I think so. The closest thing I can think to is September 12th, 2001. When suddenly a lot of Americans, well, especially one particular one, George W. Bush, wanted to make war on various people, and then I almost wrote a book called the Country That Lost Its Head. Unfortunately, the people who needed to read the book would hate it because we got the USA Patriot Act. We lost a lot of our civil and even financial liberties. We still have lost them, and so it's kind of like that. I think it gets scaled up by Facebook and other social media. And so I think that's part of it. I don't really have a really good answer for why, other than innumeracy. But of course, there was about the same level of innumeracy with the previous things. So I'm just not sure. I mean, it's possible, and this is only a possibility, who knows? It's possible this because Donald Trump is president, and people were looking, especially the media, were looking for all kinds of ways to bring him down. Now, there's some good reasons to bring him down, maybe. But anyway, I don't know. But I do want to express a little bit of a hopeful note on the economy. I don't think it will be V-shaped, and I said the recovery, and that's what I said why about the unemployment insurance and other things. And I also want to amplify Robert Luddy's point that these things were built gradually. I think one of the things we're seeing with the way the economy is adjusting is just how incredibly good it was 2 months ago. Just the ways, it turns out, well, they make this kind of toilet paper for businesses and it's not the same kind you use at home. They have this kind of food for restaurants and it's not the same. And you see there were these very, very neat supply chains. And Robert, I would agree with Robert that it's going to be hard to build them back up. But what I also believe is that people, if they're allowed to be free, will build them back up. Will it take 2 months? Will it take 2 years? I think it'll be somewhere in that, well, from August 1st, because of unemployment insurance. I think it'll be sometime between August 1st of this year and maybe August 1st, 2 years from then. And we will get it. Again, assuming the government backs off, assuming we don't get a whole lot of regulation left over. There was one little bright spot, which is various state governments relaxing certain silly regulations. The governor of Massachusetts saying, come into Massachusetts, if you've got a medical license from any of the other 49 states or DC, you're automatically licensed here. I'm hoping we see a little more of that. That would really help.
Okay, I'm going to hope we can end on some notes and reasons for optimism. One thing I'll mention is, our stock portfolio went down, and I think that indicated how people were worried about how the economy could be decimated. But I do think that as things have turned out to be a little bit less dangerous looking than the initial predictions, the stock markets have been recovering. And some people look at that and say, oh, stock markets are terrible. They're ignoring the deaths that are going on. But really, the investors are just people predicting future profitability of the companies that they're investing in. And if the economy recovers, then the stock prices should be rising now. And so we've had the single best 2 weeks in stock market history of the past 80 years. So that is a good sign for optimism. VIX is a measure of volatility on stock markets, and that's been had gone up to record highs, and now it's been falling significantly. So there are some signs of hope. Robert, do you have any reasons why you're looking forward to the future with your business? Do you see things?
Yeah, I'm very optimistic because we have new technologies for clean air, air turnover in buildings, and American people are ingenious, they're hardworking, they're resilient, so we will rebuild, but we've been put in a deep hole by the government.
Right.
All right, great. And Knut, you've been talking about how it's already, the virus is petering out in many countries elsewhere. If you could maybe mention some of those examples, and I think you said even including the countries with no lockdowns and no social distancing. So maybe could you end with some reasons why you might be optimistic?
I think we see all over Europe and North America, and before that we have seen that in large parts of China or Asia, we see the epidemic ending. And we see the fear going away, which I think was in part stirred by the internet, spreading rumors and fears much faster than it previously could. So I would say in 2 weeks, when we see everywhere the number of new cases is down, there are no more new infections, then optimism will come back. And it was not, as I see it now, I'm naive there, but the economy was good a month ago. And other than this momentary disturbance, I don't see any fundamental changes as long as we don't change our behavior fundamentally, which we shouldn't. So if we just go back to what it was before, I think the economy should go back to where it was before too. And the only problem that we will have to do is to deal with the bankruptcies and some other structural changes that happened. But I agree, the American entrepreneurs and the American people are very powerful, very hardworking, and future.
Great, great, great. All right, so we're going to wrap up in the next couple seconds. It's at the end of our hour. We had a lot of great questions that we couldn't get to. I apologize for that, but I do want to encourage people to check out the hospitalization statistics for New York. They're going down, and deaths are going down. So I hope that we can look forward to the future. And I do want to thank our very learned and impressive guests here, and thank everybody in the audience. I apologize, I couldn't get to everybody's questions, but we've got hundreds of people here, and I want to thank you for your time and encourage you to check out our website, and we even have a couple books on this topic already. So wish you adieu.
Thank you.
Thank you, Ed. Thank you.
Thank you.